Welcome back, Dr. Saxena. So, continuing with our question where we left was, so can you kind of clarify on the myths that exist around acupressure and your recommendations to patients at large and how to approach acupressure, please?
Well, as I was telling you, that myths are numerous. First of all, people at times feel very scared in the name that this treatment pertains to nerves. And when I ask them, because the number of patients is too high and so many patients at a time cannot be attended. So certain patients who I feel they will be long time consuming, and in a way they have to adopt like patients of diabetes, hypertension and all that, thyroid. I advise them after giving 3-4 sessions or maximum 5 sessions that now you understand what is to be done and keep it doing at home. Self-help. But some of them very honestly share that, sir, you know the job. In case we do, or if I tell the husband that you do to wife or tell the wife to do to husband, they feel that we may not press a wrong nerve. That is a fear. Now I try my level best to take it out from their mind that it is not at all a treatment of the nerves. We do press nerve endings, but they are the reflex points. Now, reflex point is something, as perhaps I have not mentioned in my earlier talks with you, that we follow reflexology. And in reflexology, the palms and likewise the soles, there are reflex points pertaining to every vital organ in the body. So all that we have to do is to give stimulation to enhance their working power. And that enhancement is done by stimulation. When I call it stimulation, we just, like this sort of instrument we use, we roll and then we press on the specific points to arouse the healing power of the body. So with great difficulty, this thing has to be taken out from the minds of the people. This is the treatment of the nerves, and self-help can be dangerous. Secondly, when I come across many people who are even practicing, when they come to me, they share that when they were, wherever they took training, they were taught to press till to the extent the patient starts crying or the reflex point becomes red. Now I can't imagine that there can be a myth about acupressure more than this one. It's damaging to the therapy. Actually, in my books, if you read, I think you have already ordered 1 or 2. They're easily available on Amazon and Flipkart and so many other things. You will find that I have very clearly and categorically written that we should never exceed the pain threshold. When I say pain threshold, what I mean to convey is that the pain bearing capacity of the patient. We should never exceed that. So the entire thing can be defined in a sentence, that is, start with mild pressure, go to moderate, and never be harsh. Because sometimes the patient themselves come back when they start getting benefited. They say, sir, please press harder so that we will get soon faster. Now again they are at a mistake. Why? Because in case I give pressure more than their pain threshold, that particular spot where I am pressing, that becomes tender. And next time when you come to me, you will say, sir, it is hurting here, so do other points, and maybe that point is the most important point where you are asking me not to. So we should never be in a hurry, because in a hurry we can enhance 1 or 2 sessions, because you will come and a particular point could not be raised on that session. Is that clear?
Yes, Dr. Saxena. And the other question I have is the duration, because I know some of my friends and relatives have been taking acupressure for over a year now, right?
My good God.
Yeah, and I don't know.
Over a year for the same ailment?
For the same ailment.
My good God.
So can you kind of clarify the myth on that?
Look, this is not a myth. This is a professional thing. I will not like to comment too harshly on it, but still I cannot control myself admitting that in my whole career of roughly 4 decades, a little less than 4 decades, I have never attended a patient more than 10 to 15 sessions, at best 18 sessions, except 2-3 coma cases which I handled, where the treatment went up to 3 to 4 months even. And still the recovery is there. Recovery is neurologically 95% plus recovery is there. But still they are bedridden because they have been lying for months or years. So the body becomes stiff. And that is the job of the physiotherapist, not my job. Right? But again, coming back to your question, it makes me laugh that it is purely and purely commercial. I will rather, through this clip, I would like to reach out to those people who are practicing acupressure and they are befooling patients. I am sorry, I've used that harsh word. Because in case the recovery has to come, it should start in the worst of the cases within 4 or 5 sessions. Maximum 6-7 sessions. So any new patient coming to me, it's my set caption with every patient that look, in case you don't start getting relief, you start feeling relief. I'm not saying you'll be all right in 3-4 days, but yes, in case you don't start feeling relieved that I'm going in the right direction, stop my treatment. I don't think I should say anything more than that. Your sister should immediately stop that treatment. She is being befooled.
Thank you, Dr. Saxena.